Well, April the 20th to 27th is National Immunization Week, and we're here to help raise awareness about immunization. And we're here with Bernita Nezjan, who is the Public Health Resource Nurse for Northern Health here in Valemount. Welcome, Bernita.
Well, thank you for having me and for the opportunity for such a terrific health promotion topic.
Well, great. Well, it's very timely, as I said, because it is the week for it. So what I want to start with is trying to get an idea of what exactly immunity is, what vaccines are, and how do they work?
Good questions. Okay, so let's start with immunity. So immunity is the protection from a disease. So therefore, if you come in contact with the disease, you don't become sick. Right, so that's the immunity part. And then the other part was what are vaccines? So vaccines are products that we use to produce immunity. They're often given by injection. Some are given orally and some are even given nasally, sort of up the nose. And then...
How do they work?
How do they work? That's a good question. How do they work? So vaccines work the same, so when you get a vaccine, your body recognizes it just as if you were getting the actual germ. So your body has to recognize the germ, and then it says that that's a foreign to it, so it doesn't belong. So it produces antibodies in response to that germ. And then the other thing that it does is it remembers what that germ is, but it also remembers how to destroy it. So then later in life, when you come in contact with that germ, your body will remember it, so they recognize it, and will quickly destroy it even before you ever get a chance to get sick. So that's called immunity, and that's what keeps you from getting those vaccine preventable diseases.
Okay, great. Well, people may or may not know that we have a publicly funded immunization system here in the province of BC. It provides immunization for, and I'm going to read the list, it's a pretty long list: diphtheria, pertussis, or whooping cough, tetanus, polio, hepatitis A and B, meningococcal disease, pneumococcal disease, measles, mumps, rubella, chickenpox, influenza, HPV, rotavirus, and shingles.
That's right.
So it's quite a list, and some of them are given in childhood, and some can be given at any time during life. And especially shingles is usually something given to older people, the shingles vaccine.
That's right.
So let's talk a little bit about childhood vaccines. What are the typical childhood vaccines out of that list that they would receive? Out
of that list? So we start immunizing fairly early because children are one of our most vulnerable groups. So we like to start those vaccines. So typical vaccines that they're vaccinated for are tetanus, diphtheria, polio, and the pertussis. Haemophilus influenza type B, which wasn't on your list, but that's part of it.
Another one.
Yep. And polio and as well the hepatitis B. And so those are often given together. And then so we have a recommended schedule for some of these. And then as they get upwards around that 12 months, then we also add in measles, mumps, rubella, and the varicella, which is the chickenpox as well. And then some of those are boosted as we go along.
Okay. And what is the starting age for the first round of vaccinations?
Yeah,
usually?
The starting age where we start babies is at 2 months.
Okay.
And then, so the schedule from there goes 2 months, 4 months, 6 months, 12 months, which is a year, and 18 months.
Okay. And then as the kids get older, there's boosters required or recommended?
Yeah, that's right. So some of the vaccines can kind of wane a little bit. So those, we add a booster, so you continue to be protected for that. And then as we get into the school age, then there's those schedules as well.
Okay. About how old would they be in school age for getting that next round of vaccine?
Yeah, that's a good question. So after the 18-month vaccine, then we start again at that school age, which is when they're entering into kindergarten. So we have the kindergarten age that we do, and then we do the grade 6 and the grade 9 as well.
Okay, great. And then there are people who, when they're going on trips, may get vaccinated for hepatitis A or B or some of the diseases that they may find outside of the country.
Exactly.
So I guess the next logical question is, why should people get their children vaccinated?
Okay, why do we want to vaccinate?
Right.
Yeah, why do we want to vaccinate? That's a big one. So really the big thing with that is we want to vaccinate because it saves lives. The germs are still out there. and it protects everyone. So if we kind of look at it saves lives. So things like the World Health Organization, they estimate that there's about 2 to 3 million people, lives that are saved every year. Sort of that's worldwide. But we could kind of bring that in a little closer to home and say into Canada, within the last 50 years, vaccines has saved more lives than any health, medical health intervention. So that's kind of that saving lives part, and then the disease is still out there. So in Canada, because we vaccinate, a number of these vaccine preventable diseases are kind of rare because we immunize for them. But the germs are still out there. So we see pockets of things like pertussis, like whooping cough. We see things like measles and mumps. And if our vaccination rates are to drop, what happens is we see more of that disease increase, and these pockets will become larger into epidemics. Right. So that's the other thing. And then protection, that was what we were saying, is that it kind of protects everyone. Because if there's more people vaccinated, it's more difficult for the disease to spread. And we want to protect those early babies that maybe are too young to be vaccinated. And then there's a whole group that might not be able to get a vaccine, say for medical reasons.
Right. And I mean, people think these kinds of things are rare, but we're in the middle of a measles outbreak right now. I believe there's been at least 20 reported cases in BC here alone.
That's right. Yes, absolutely. That's a really good point. And so we will see those pockets of, say, the measles, for instance, that are, say, maybe it's a traveler. So they've been brought in from out of country. But then if you have a group of people that are unvaccinated, then the risk of getting in contact with the measles is quite high.
Right. And some people say, well, you know, measles is a childhood disease. Many of us had it before the vaccinations, etc. But it can be a very serious disease, and people can die from it, right?
Absolutely. Measles is a very serious disease, and it can be fatal as well. And it's one of the most communicable diseases that we have. And you can catch it from being in the room after somebody's left, up to 2 hours. So it's a really easy one to pass around.
Right. And some of the vaccines are so successful. For example, polio. I don't know when the last case of polio was reported, but at one time, you know, it was a scourge, and many people suffered from polio.
Yes, polio has been very devastating over the years. Isn't something that we would regularly see in Canada, but we do see it in other countries. But another really good example of that is due to vaccines, we are no longer any risk for smallpox, right?
Right.
But like you're saying, because some of these things are rare, if we continue to vaccinate, maybe we could also wipe out polio and measles.
Absolutely. I want to ask you about something that I read a little bit about that I don't quite understand, so maybe you can explain it. And that's it's called herd immunity or community immunity. What is that, and how does that work?
Yeah, that's a really good question. So just in really simple terms is if you have the majority of people vaccinated, if you come in contact with somebody that has a disease, it's harder for that disease to spread around. So therefore, the disease won't spread. Right. As easily. So then again, if your vaccination rates are up, then those diseases are less likely to spread. Right.
And as you said, there are some people who are unable to get vaccinations, such as children under the recommended ages, or sometimes older people, or people with compromised immune systems.
Exactly.
Those
yes,
types of things,
precisely.
Right? Okay. Let's talk a little bit about vaccine safety. So are the vaccines, well, we'll break it down so it's not so much at once. Are the vaccines that are used in Canada safe and effective?
Canada has one of the best safety programs in the world, vaccine safety programs in the world. So we're very fortunate with that, and vaccines are safe and reliable in Canada. Just because there is a lot that's involved with that, we would often recommend the Immunize BC website, so it's immunizebc.ca, and they have quite an extensive question and answer on vaccine safety in Canada and how they go about that and all the various steps that are involved in it.
Okay.
And sort of the length of time. So I encourage people to check that really great website out. It's reliable, it's evidence informed, and it's very credible as well.
Okay. Who is responsible for approving the vaccines that are used in Canada?
That's sort of that bigger government piece. And again, I would encourage just to have a look at the Immunize BC website, because it kind of really breaks it down for you to really answer that, because those are certain bodies that are held within the government and within Health Canada.
Okay. And out in the field, how are the effectiveness and the use and the safety of vaccines monitored?
So Canada does have a safety sort of Canada-wide monitoring procedure that they follow. But again, I think just to really fully answer that, if people wanted to look at the Immunize BC website, it really sort of breaks it down into those pieces that might be able to fill that question out a little bit more, if that's
great.
helpful.
Let's talk about something that does concern some parents, and that is potential side effects from vaccine. So what would any of those be that have been reported?
Yeah, side effects, that's a really good question. Just remembering that vaccines are one of the safest medical tools that we have. And in regards to side effects, the most common things that you'll see is sort of a bit of soreness or swelling at the injection site, either at the arm or in the leg if you're doing the small children. And then maybe a bit of a fever. These things sort of last just 1 or 2 days. And those are sort of your most common things that we would see.
Okay. There was a report, and I'm not sure when it came out, it has to be at least 20 years ago now, between the what they call the MMR vaccine, which is measles, mumps, and rubella, and a connection to autism. It was later retracted and proven to be incorrect. What can you say about that, and why was it incorrect?
Right. Well, that's kind of a big question. Again, for the specifics on that one, the Immunize BC website is fabulous. It kind of really breaks that down. But remembering in Canada that we have very safe vaccines, and we have a very safe procedure for that. And this is evidence-based, and really rigorous research goes into this. And that is sort of part and parcel of that.
Right, and so what they were saying was that there was a link between autism and vaccines, and that has been totally disproven.
Absolutely, exactly. And if you want sort of this particular details of that, that is really clearly defined on the Immunize BC website. But just exactly like you're saying, is that there has been no scientific connection to that at all. But to clear that up probably on the website, then you can kind of sort of see how they break that down.
Right.
If that's helpful.
I tried to speak with someone, with people who held opposing views. There are people who are opposed to vaccinations for various reasons.
Certainly.
None of them would agree to be interviewed on camera for fear of themselves and their families being harassed, and that's a very real thing. It's vaccination versus anti-vaccination is a very polarized, highly polarized topic, and it's not an easy thing for parents to speak about in general. But one parent I did speak with, who wants to remain anonymous, has 3 children. They're teenagers now or older. They were not vaccinated. The parent told me that as parents, they read articles, they did their research, and have come to the conclusion that vaccines are not natural and may have negative effects, especially on an undeveloped brain. To them, vaccinating their children didn't seem right. That was a personal choice. They have some circumstances that make it well, I'll share all the circumstances. Their children were homeschooled, first of all, for the majority of their educations. Outside of the cold, regular colds or flus, they never had any major sicknesses, never contracted any of the diseases that were typically vaccinated against. They use a herbalist and believe in using natural methods to boost the immune system. And they say that vaccinating children is a personal decision, and that they respect the decision of parents who wish to vaccinate their children. They just wish that others would respect their wish not to vaccinate as well. And they felt, there has been a little bit of backlash to the few people that they've told about that. So in general, what would you say with regards to the vaccinate, anti-vaccinate I won't even call it a debate, it's stronger than that.
Right,
that's
right.
happening now.
Right. Boy, that's really sort of a loaded statement. So thank you for sharing that story. That's very interesting. I think any time that our children are involved, there is a lot of emotion. But of course, working within preventative public health, I come from the view that and vaccines are very safe in Canada. We know that, and we rely on that. And that is the background that I would come with. And you know, that you are when you're not vaccinating your children, that certainly is the riskier choice. But at the same time, that is still a choice that we have within BC.
Right. I should also point out that they have brought their children here for various, kid accidents that they've had, and that they told me they've never felt pressured from the physicians here. They've been advised of the benefits and the medical science that goes behind it, but they've never felt that pressure. However, their children have with other children, and they have with other friends as well. So it is one of those things. I would like to ask you if you could describe what the risks and responsibilities that parents with unvaccinated children would have, so people understand. I think it's very important to let people understand that yes, you do have a choice. It's not mandatory vaccinations. However, these are the risks.
Yeah, that's a really good question. So there's really a lot to consider when you have a child that's unvaccinated. So I would certainly direct people to the Immunize BC website. So some of the things you might want to think about is if you have that unvaccinated child, is that you're really monitoring them closely if there is an outbreak in your community, or if you happen to be traveling to a community where there's an outbreak of any sort, and remembering that depending upon which disease it is, you may be requested to keep your child home from school or from daycare, and that not vaccinating your child sort of is the riskier choice than vaccinating, because vaccines are very safe and they're easy to access, here at the health center or in McBride. And if people had sort of a specific concern or a specific question, I would certainly encourage them to seek out, any one of their healthcare providers, and just to maybe have that conversation and find out more about their concern or their questions.
Right. Okay, great. There is a trend, I don't know how big a trend it is, but there is a growing trend toward not vaccinating children. That's why we're starting to see, measles outbreaks and recurrences of some of these diseases we basically thought were gone, or hopefully we thought were gone. I would like to give you this opportunity to make the case for vaccinations. So pretend I'm a parent coming in that has unvaccinated children. Why should I do this?
Yeah, so vaccinating is sort of one of the safest, most effective ways we have of preventing disease. And as parents, we all want what's best for our child, and we want to make sort of decisions with the information that we have at hand. So then that way, if you could kind of look at, say for instance, the Immunize BC website, that is evidence informed. It's very credible and reliable, so that can answer some of those burning questions. But also if you had more specific questions that you couldn't have answered by looking at, say, a website or speaking with friends, then I would certainly seek out your care provider and ask those specific questions. But just remembering it's safe and it's effective and it's the best way to prevent these diseases.
Okay, great. And for anyone in Valemount here who has specific questions, could they contact you or their physician?
Sure, absolutely. At our integrative, anyone within our integrative team can answer those questions. So we have a main line that you call into, and we have the nurses, we have myself or any of the physicians that could answer any of those specific questions. And that's certainly the same place where you can book appointments for immunizations, Or you could also just even have an appointment to have like a consultation to talk it over, to answer those questions. And that would be the same in McBride as well. So really easy access on all those days that the clinic is open, Mondays to Fridays.
Great. Well, happy
Immunization
Week, yeah, National Immunization Week, and let's
Yeah.
hope that people take this information and go further and do their research if they still have some questions, and get out there and get vaccinated.
Yeah, absolutely. Get out there and get vaccinated. Thank you very much.
Thank you for doing this.
Okay.